Welcome back to Untold Physio Stories podcast. I'm your host, Dr. E, with Modern Manual Therapy and Edge Mobility System. So I wanted to talk about a case, a patient who I've talked about a few times in the podcast in the past. I've seen her. She was centrally sensitized for some serious rib issues. She responded very, very well. Ended up being a rapid responder despite being highly fear avoidant and centrally sensitized. So in the past, she's responded very well to myself, the therapy that I gave for her rib, and she had shoulder surgery for an issue I was unable to help her with, and then she came back after her surgery, and rehab went very well. But she's had this kind of chronic jaw pain of varying degree that kept on getting worse and worse, and regardless of the treatment that I would give her, and she was seeing a ton of other different specialists, whether it was a chiropractor or the UB dental clinic that she was seeing, they would basically tell her this is a medial pterygoid issue, it's a muscle imbalance issue, you need to have your tissues released. She would get varying degrees of success with some sort of tissue release, and she would come back to me sporadically and say, look, can you do an internal medial pterygoid release on me? And I said, look, when I got certified by the specialist that I learned under, Dr. Mariano Raccobato, in 2004, he had pioneered physical therapy treatment for the TMJ, and he said as of 2004, and I don't know his stance now, that he had given up that internal soft tissue kind of deep friction massage. And the way I describe it to patients is like you're palpating, and again, palpation isn't very reliable. We don't really even know if we're palpating the thing we're supposed to be palpating, and just because something is tender doesn't mean you need to go mash it. But even if we could palpate the medial pterygoid, we're palpating a very small percentage of that muscle, and it's often tender even on people without any symptoms. Just like the coracoid process or the upper trap, those are very commonly tender places that just because they're tender doesn't mean you need to go, mashing it to reduce the sensitivity. So I call the technique fish hooking because it's kind of like taking your finger and just going like, just jamming it in and just rubbing an area that's tender. So I kind of refused to do that, stood my ground. She had come to me for a completely different issue again, and her rib issue flared up. She said, look, can you take a look at my jaw? And also I found a video that relieved most of my complaints. And her complaints were, other than her intraoral pain and lateral jaw pain and masseter pain, that stuff I was able to relieve at least 50%. One of her strangest complaints was that she had a coppery taste in her mouth, and infection and intraoral bleeds were all ruled out, but I thought that was kind of an unusual symptom that always had me worried in the back of my mind. So she had seen me, and she said, look, I found a YouTube video, and I know what you're going to say. And I was like, look, yeah, I don't want random Dr. YouTube. She's like, I really want you to watch this. To me, I think it's like the side glide, the lumbar side glide of the jaw. So I look at this video, and I can't remember if it's a chiropractor or a physical therapist or a dentist, but he basically says, using the left side example, and this is also a video podcast if you watch it on YouTube, if you take your thumb and you put it below the molars on the involved side, and you just push laterally, particularly on the pad, so almost tilting it like that, and you push laterally toward the symptomatic side, and you hold it for 1 minute to 3 minutes or so, then that will relieve complaints. And she did this, and it was the only thing that gave her 80 to 90% relief. And the most interesting thing is it also completely eliminated that coppery taste, which I don't know, must have been some sort of referral pattern or something. So I watched the video, and she said, can you do this to me too, to see if we get more relief? And the only modification I made was an opposing shear force on the temporal bone. So I put my thumb in her mouth, pressed laterally, and I pushed medially on the same side temporal bone to give a little bit more overpressure. And it wasn't a lot of force, but I sustained that for about 1 to 3 minutes. I started off with some light oscillation, like pressure on, pressure off, almost like doing a lumbar side glide. And after this, she got 100% relief, and I taught her the variation with the head temporal force pushing medially. So she was really happy, and I learned a valuable lesson that you should give more credence to random YouTube videos every once in a while, especially when you are not getting anywhere with a patient. Let me know what you think of this case, or if you've ever run across, or if you do a similar technique yourself, especially for TMJ patients, or if you ever heard of that coppery taste, which I thought was, again, an unusual complaint. As always, if you enjoyed this story, if you have, please rate Untold Physio Stories 5 stars wherever you listen to podcasts, especially on Spotify or Apple, as that helps our discoverability. And you guys have a great day.